Are you struggling with pain in your thigh? Maybe it's when you're walking up or down steps, or maybe you're just out for a stroll, you turn the wrong way and you get pain down the front of your thigh down towards your knee. Or maybe you've noticed some weakness or your knees buckling at different times throughout the day and it doesn't feel quite right. Or maybe you have some constant tension, aching in the muscles, numbness, tingling along the front of the thigh, and you're trying to figure out what's going on. If that sounds familiar, this video is going to be great for you. I'm Dr. Putney from Wellington Family Chiropractic. And today I want to talk about a condition that we see in our office from time to time where the femoral nerve is getting trapped. So what is the femoral nerve? Well, it comes from inside the pelvis and it runs down from the low back through the pelvis to the front of the thigh. It helps you flex your hip. It helps stabilize the knee, and it gives sensation to the front of the thigh here. And it can get trapped in the low back or in the hip flexors as it's going down to the leg. And when this happens, it can be very painful in the thigh itself. And like I said, it can actually create some muscle weakness or jolting pain as you're walking. So like I said, this can come from the low back. So sometimes typically we just treat the low back. But what I want to give you today are 2 exercises that I give all my patients whenever they're dealing with any femoral nerve entrapment or any symptoms that seem to be arising from some sort of pressure on that femoral nerve. They're easy to do, and a lot of times just these 2 alone can really help with your symptoms of that thigh burning or thigh aching or any weakness or clumsiness you feel like the leg itself is experiencing. If you're wondering, like, is it true nerve entrapment? A lot of times people will describe it's not there all the time, but as soon as, especially I try to go down steps, it gets much worse. A lot of times that's a key indicator for us if we're not quite sure what the cause is. But what I'm going to give you is 2 exercises. We're going to give you what's called a femoral nerve floss, and then a stretch for the muscle where the femoral nerve is near that sometimes can put some pressure on as well. So a nerve floss or a glide, and then a stretch for some of the structures in that area. And like I said, if you give these 2 a shot, a lot of times they can help you out a lot with that anterior or front-sided thigh pain and muscle problems. Okay, so the first exercise we're going to go over is a femoral nerve glide or nerve floss. And this, again, to help with that anterior or front-sided thigh burning or tingling or pain. What you're going to do is you're going to put the side that's affected up. So my symptoms would be on my left side in this case. And you're just going to lay on your side with your knees bent. And then what you're going to do is just rest this top arm wherever it falls comfortably. And then you're going to flex that leg or bring that knee towards your chest. And you want to have your chin almost like you're looking down or tucked at that knee. You then extend the hip as you bring the head back. So it's chin down, knee up, knee back as the head comes up. It's very easy. You're not straining. You're trying to extend as far as you can in both your head and your hip, so your legs coming behind you as the head comes back. This should not increase your leg tingling or leg symptoms. Again, we're trying to floss or move that nerve through the structures in case it's getting impinged or caught on its way down the leg. So typically what I'll have my patients do is 3 sets of 10 of these nerve glides, and we'll do that 2 to 3 times a day if they have a case where they're feeling that a lot in the leg. All right, so the second exercise or stretch we're going to do in this video is going to be for the hip flexors or the psoas group. And what we'll be doing is, in this video, I'll be stretching my left side. And so again, like with the nerve floss video, you want to have, you're treating the side where you're having the thigh symptoms. So my left leg here would be the one with the symptoms in this case, for this example. So what I'm going to do is just get in a kneeling position here. And I want to try to not overarch my low back forward, get in a neutral, almost posterior neutral position with the pelvis. And then what I'm going to do, without tilting back, we're going to lean the pelvis forward. And you should feel a nice pull in the quad and this area of your lower abdomen here. You don't have to bounce, and we don't want to jolt that area for this stretch. Again, it's just a nice little tuck there, driving it forward. You can add in some extra stretch by taking that arm on that side and reaching up and across, almost like you're reaching across your head there. And just breathe. And we'll hold this for about 30 seconds. And we'll come back down, maybe do 2 to 3 sets of that in the morning and the afternoon, so you're getting in this stretch twice a day. So again, for that stubborn thigh pain, for those people that aren't sure what's causing it, a lot of times it can be that femoral nerve getting trapped somewhere. So if you do the nerve glide and then you work on loosening some of the muscles that nerve has to pass by or go through, a lot of times we can decrease the symptoms and improve the function of the leg in that area, and hopefully clear this up for you guys. So give those things a shot. Hope they help, and I'll talk to you soon.